Hi guys, today we're back, and in this lab today we are going to be talking about the nervous system. We're going to be looking at two different brains today as we talk about the nervous system. The first, and the one that I have here, is the sheep brain. The next one is going to be the shark brain, which we will discuss in future videos. So today, like I said, we're going to start with the sheep brain, and the figure that we're going to be looking at first is figure 10.10, so 10.10. Now, when you get your sheep brain, it is going to be encased in this protective covering called the dura mater. So we're gonna have to first remove that dura mater. So I'm going to show you how to go about that. In terms of the dura mater, think of it like an eggshell covering an egg, a hard-boiled egg. And you're going to want to kind of peel it away without affecting your brain tissue. So in your brain here, we're going to want to, you can gently use scissors, you don't want to hurt your brain, or you can kind of peel it away with your hands. Ideally, the more you can get in one piece, the better. And then you can cut that portion off with scissors. So I'm just going to take my scissors here and cut away. Better to cut less because you can always go back and cut more. But if you cut an important structure, it's hard to go back. So we're just gonna cut. And there are going to be portions of the dura mater, for example, that are stuck between the different portions of the brain. So you can just, just be gentle around those areas. Now this should be enough of the dura mater removed for this first figure. First, we're going to discuss the three main parts of the brain. This isn't associated with any figure, but is just to get you acquainted with the organ. So first we have the cerebrum. Next we have the cerebellum. And third we have the medulla oblongata, which we see best from the ventral side of the brain. So the medulla oblongata, which then has the spinal cord extending from it. So we're going to trace back to figure 10.10, and we're going to go over the terms that we want you to know. So number one is sulcus. So these are the grooves in the brain that are separating out number two, which is the gyrus. So here's examples of gyrus. Number three is the median sulcus. So that's going to divide up and go through the cerebrum. Number five, you do not need to know number four. Number five is the hemisphere of the cerebellum. Now the cerebellum has two hemispheres. Here's one of the hemispheres. Here's the other hemisphere. And number six is the vermis of the cerebellum, which is between the two hemispheres of the cerebellum. Number seven is the spinal cord. Number eight are the folia, which are the irregular folds in the cerebellum that are broken up by different grooves. So examples of folia are what I'm touching with my probe. And then last but not least, we have the cerebral hemisphere. So just like the cerebellum has hemispheres, so does the cerebrum. This whole portion, separated by that median sulcus, is a cerebral hemisphere. And then the other cerebral hemisphere is along this side. In this video, we are going to discuss figure 10.11. To get better visualization of the underside of the brain, I was able to remove all of the dura mater. I was able to make a cut in the center of the dura mater which then opened up and released all of those more difficult regions. So you are going to want to remove all of the dura mater to be able to see the underside of the brain the best. So we're going to start with number 1, the olfactory bulb. Some of the specimens we have the olfactory bulbs removed. The olfactory bulbs in this brain are removed, but they would overlie this region. You can even see the area of the disrupted tissue where they were removed. So you'll have to find out in your specimen if the olfactory bulbs are present, but they would overlie this region. Number 5 is the next term we need you to know, which is the optic chiasm. This is the central portion. And I'm going to jump to number 28 because I think it makes the most sense. The optic nerve comes off on either side. That's cranial nerve number 2, and it comes off the optic chiasm. So number 5, optic chiasm. Number 28, optic nerve. This side is more intact than this side, but they come off in both directions. Next, we have number 6, the infundibulum. This is the little stalk. It's a remainder of a stalk. I can even lift it up a little bit, but I want to be careful that I don't hurt the specimen. But the infundibulum would have the pituitary gland attached to it, but in this case, the pituitary gland was removed. So we need you to know the infundibulum that leads to the pituitary gland. Number 7, the tuber cinereum is on either side of the infundibulum. So tuber cinereum, tuber cinereum. Number 9 is the piriform lobe that we can see on either side. Piriform lobe. Number 10 is the mammillary body. Here is the mammillary body, and we see kind of going cranially, we have the tuber cinereum. Now, in the picture in your lab manual, it does make the mammillary body look more like 2 structures. There can be variation within specimens, but I do expect the majority of yours to look more like this, which is a medial swelling. Number 11 is the rhinal fissure, which we have along here. I'll show you on the other side, the rhinal fissure. Number 13 is the circle of Willis. That's a series of blood vessels in this area. Now, some of the ones along this side were disrupted, but you can see better on this side where we're having some of those vessels. Number 14 is the pons. Here's the pons. Number 15 is the medulla oblongata. Number 16 is the cerebellum, which you should know from the previous video. Number 17 is the spinal cord. And then lastly, as we already discussed, number 28 is the optic nerve, which comes off of the optic chiasm. For this video, we're going to be discussing figure 10.12. And for this image, there's a lot of terms. So it's going to be really important for you to read your lab manual and compare this video to your lab manual. And also, a lot of the structures can be difficult to see since the tissue is the same color. So it's going to be really important in your lab manual to read the descriptions of these structures because that will help you identify things in real time. To start for this, we are going to have to make a sagittal cut. So I have already made a cut, but I'm going to show you how to make yours. So you're going to use your scalpel, and you can use this median sulcus as a guide to stay along midline. You're going to want to cut all the way down with your scalpel. That way you're not doing a hacking back and forth motion. And you just want to go follow it along. And once you get to your cerebellum, just stick to as much along midline as you can and cut all the way through. So here we go. One of your sides may be better than the other for identifying certain structures. One of your sides might be better for some structures, the other better for others. We want to make the cut as perfect as possible, but unfortunately, none of us are perfect. So we're just going to have to, use the best one that you have. For the one that I am going to use for the purpose of this video, I am going to choose to stay along the line of the same view that the textbook has. I think that will be easier for you guys when you're examining, your specimens and watching the video in comparison to the lab manual. So we'll get started with number 1, which is the central canal of the spinal cord. Now, this is just a matter of shading that you can really see the difference. I suspect you'll be able to see it better on your specimen, but there is a slight difference in shading where the canal of the spinal cord is versus the rest of the spinal cord. Number 2, we have the cerebellar cortex. So we know that's in the cerebellum, and the cortex is those areas that look as if they'd be leaves on a tree, is your cerebellar cortex. Number 3 is your arbor vitae. So think of a tree again. That's where we get our name. So the arbor vitae is the area that would look more like the trunk or the branches of the tree, is the arbor vitae. So for example, arbor vitae, cerebellar cortex. Number 4, we have the inferior colliculus, which is a small rounded portion that's right next to the cerebellum. So this is the inferior colliculus. Then we have the superior colliculus, which is the larger rounded region next to the inferior colliculus. So superior colliculus, inferior colliculus. Number 6, we have the pineal body, which this ended up all on this side for me. So on my other half, I can't see the pineal body, but we can see that here's the pineal body. It looks like a pretty distinctive protrusion of a structure. Number 7 is our splenium. And the splenium is this sort of rounded end portion of this larger structure, which we'll be discussing the other terms. So the splenium is here. Number 9 is the habernacular trigone, which we can see in relation to the pineal body. It's a little, it's a cranial and ventral to the pineal body. Number 10, we have our corpus callosum, which is this line going along after we had our splenium. This becomes our corpus callosum. Number 11, we have the massa intermedia, which is a rounded segment, and we know that above that would be our habernacular trigone. Number 12 is our fornix. So sort of on the opposite side of where our corpus callosum was, we have our fornix. Number 13 is the lateral ventricle. So a ventricle being like an opening, a segment essentially here in between the two regions that we just discussed. Number 14 is our septum pellucidum. I would say this looks a little bit more of a deep opening on this side. And number 15 is our genu. If you think of genuflecting, if you're familiar with that term at all from church, it's where you bend your knee. So it's kind of as if it's the knee of this larger structure. Number 18, we have the optic chiasm. And you should remember that from our previous video. So if we were to turn this over, We know that we have our optic chiasm that leads into the optic nerve. So we know our optic chiasm is here. We're just looking at it from the sagittal view this time. Then we have number 19, our third ventricle, which is lying underneath the massa intermedia. Number 21, we have our mammillary body. And this I can turn over our specimen. We know we have that medial swelling of the mammillary body. So our mammillary body would be here. It's just slightly off midline in this cut. Next, we move on to 23, which is our tegmentum. This is also known as the cerebral peduncles, and this is coming after our mammillary body. Number 14, we have the number 24, we have our lamina quadrigemina, which lies underneath the superior colliculus. So we have the superior colliculus and the lamina quadrigemina. Number 25, we have our aqueduct, which you can see is a little bit of an indentation. Number 26, we have our pons. 26 is the pons. Just like with the mammillary body and the optic chiasm, we can turn it over. Hello, pons. So we know there is our pons. Number 28 is the medulla oblongata, which is along here before it turns into our spinal cord. So as you can tell, this is a lot of terms. It can be very confusing. So we want you to really focus on your lab manual, read the descriptions, and get familiar with the structures, the spelling, all those good things.